Tracheostomy Site Care by Nobrega.
Tracheostomy site care should be performed daily at a minimum, and tracheostomy times should be changed daily to allow for assessment of the tracheostomy stoma and the peristomal skin, as well as the surrounding skin of the neck. Tracheostomy site care can be performed with sterile saline. Consider quarter-strength hydrogen peroxide for sites with drainage, and consult your institutional experts for assessment as needed. Neck care can be performed with mild soap and water. Removing tracheostomy ties is always a two-person procedure. This procedure can be performed by any combination of nurses or caregivers. Ensure that only one small finger thickness can be inserted between the neck and the tracheostomy ties in the sitting or side-lying position. The inner cannula of a double lumen tracheostomy tube is cleaned or replaced at least once a day and as needed. A nurse or caregiver can change the inner cannula. Now we will review cleaning a tracheostomy site. The trach ties can stay on during this procedure. If the trach ties are intact, only one person is required to clean the trach site. However, if the ties are loose, or if you are changing the trach ties, 2 people will be required to complete this procedure. The first step is to remove the soiled dressing by gently lifting up on the flanges and pulling out the soiled dressing. Next, in one hand, take a cotton-tipped swab that is moistened with either normal saline or diluted hydrogen peroxide solution as prescribed. Gently lift the trach ties and flanges, exposing the edges of the tracheostomy site. Clean the tracheostomy site with the moistened cotton-tipped swab. Twist the moistened cotton-tipped swab in your fingers as you move around the edges of the tracheostomy site. At this point, while the trach site is exposed, you want to check the skin surrounding this area for any signs of redness, pus, granulomas, blood, or secretions. If signs of infection or bleeding are present, a discussion with the healthcare provider is warranted.
Point of clarification. To prevent skin irritation and breakdown, ensure the site is dry prior to placing the dressing over the tracheostomy site.
Once the tracheostomy site is clean, a new dressing can be applied to the tracheostomy site. To do this, take your new dressing and gently put it under the flanges and trach ties so that the dressing is directly against the skin. Use a new cotton-tipped swab to aid in positioning the dressing around the flanges of the tracheostomy tube.